Okay, so for today's session, we will be discussing about the range of motion in your shoulder area. So when we move our shoulder, it doesn't only mean na isa ra ang joint na mo contribute sa motion. So for example, if we move our hands up, diba? If we move our hands up, the main nga joint na makita na to is in this joint, your glenohumeral joint. But try to palpate your clavicle here on the sternal side. If you try to move your hands up, there's also motion, meaning the shoulder movements are very complex. It doesn't it's not limited to one joint only. So you have a lots of joint. First, you have your glenohumeral joint. Where is it located? Here, your glenohumeral joint. Next, you also have your sternoclavicular joint. Here, the sternum and the clavicle. And next is your acromioclavicular joint between your acromion process and which links to your scapula and the clavicle, the end part of your clavicle. Also, we also have your scapulothoracic joint. So your scapulothoracic joint extends towards the back. Here, your scapula. So these are some of the joints that contributes to the shoulder movements or your shoulder motions. Okay. So before we can measure the ROM of your shoulder, we have anatomical landmarks. Remember, same with your cervical area. Remember, we have the external auditory meatus, you have the tip of your nose, and then so on. So, in the shoulder area, we have first your clavicle. You already know where your clavicle is. Okay, the sternal part of your clavicle or your sternal end here, and the acromial end. Next is your scapula, which is the bone, triangular bone at your back. Next, you also have your sternum here on your chest, and you also have your greater tubercle. So your greater tubercle is, if you can palpate your greater tubercle, this is the here, like masyag 2 fingers lang, because you can feel already that there's a protrusion or the tubercle here on your humerus part. Okay. Next, you also have your lateral epicondyle of the humerus. So remember, you have this is the lateral side and this is the medial side. So your lateral epicondyle, remember here, diba? Duha man na ka epicondyle. So this one is the lateral epicondyle. You can palpate that. Yan ang murag ana, diba? Ang bone is ana man siya. So kanina end and it's on the lateral side. Next, you have your olecranon process. So your olecranon process is at the back, posterior side of your forearm, and this one kanang murag elbow diha. Kanang gitawag na to elbow na diha ang olecranon process. Okay? So again, you have your lateral epicondyle. You also have your greater tubercle. You also have your olecranon process. You have your clavicle. You have your sternum. You have your scapula, humerus, this bone, and your medial epicondyle here. So those are the anatomical landmarks for the testing procedure of your shoulder range of motion. So for shoulder movements, we really have to use a goniometer. First motion that we are going to discuss is your shoulder flexion. How do we flex our shoulder? Okay, your shoulder flexion is like this. Okay, you will just move your hands up. Okay, that is your full range of motion of your shoulder in flexion movement. And then, if it's towards the back, this one is your extension. So first, we have your shoulder flexion. So the position, but don't forget when you do the ROM, you still have to do your rapport, you still have to do briefing or orientation to the patient. You also have to uncover the area that you are going to measure. So for example, the patient kay nag long sleeves siya, so pwede you ask permission if you could roll the sleeves of the sleeves sa shirt sa patient. Okay, so next, so the normal end feel of your shoulder flexion is firm because of the tension of the posterior band of the coracohumeral ligaments, and then the joint capsule, and then the muscles also. So it's the end feel is firm. So the same procedure, don't forget to do passive range of motion or the execution of the motion before proceeding to your active range of motion. So the position of the patient when you do the shoulder flexion, you could let the patient lie down in a bed or on a flat surface, and then the fulcrum of the goniometer is located over the lateral aspect of your greater tubercle. So, shoulder flexion, goniometer, axis is naa diri, and then the stationary arm is parallel to the mid-axillary line of the thorax. So when you say mid-axillary line of the thorax, this one, mid-axillary line of the thorax, this one, so parallel siya. So si goniometer is naka patong lang siya sa imong arms. And then your mobile arm is also lateral to the midline of the humerus. So, actually, same lang siya. O position, you could just put it here, lateral of the humerus, same. And then, you have to instruct the patient, ma'am, can you bring your shoulders up, or can you point your shoulders up to the ceiling? And you could give that type of instruction. Or if ever there's problem with the comprehension, you could just do visual demonstration. So the normal range of your shoulder flexion is 0 to 180 degrees. So you have to instruct also the patient that kung unsa lang ang iyang makaya, mausad ang inyong i-measure. Okay? So, next we have your shoulder extension. When we do the shoulder extension, syempre it goes to the back man. If nakasupay ng patient or nakalay down sa bed, unable siya mo do sa activity because malimit naman sa bed. So the best position is you could let the patient do a prone position. Okay, the prone position. And the normal range of your shoulder flexion is 0 to 50 degrees. Some might go beyond 50 degrees, like 52, between 50 to 60, because some other books kay nasa sila 50 to 60. But the average is 0 to 50 degrees. Okay, so again, the position of the patient is prone with the face turned away from the shoulder being tested. Okay? So, for example, nakahigda na ka, ana, kanisi ang gites, na bed diri, ana, bed, ang imong face is away from the shoulder that is being tested. Okay, so if you could see here, this is the position of the patient. Okay, so the normal end feel of your shoulder extension is still firm because of the ligaments, the structures, and the muscles at the back. Okay? So, the position of the goniometer is still the same. The fulcrum is still at the greater tubercle. And then, the stationary arm is still parallel to the mid-axillary line. And then your distal arm or your moving arm is parallel to the humerus or the lateral epicondyle of the humerus. So, by the way, gi-call siyang ang stationary arm is just parallel to the mid-axillary line because di man siya move. So, you have to keep it always parallel to the mid-axillary line. Although, in pagput nimo, same lang siya og position because inig move, mid-axillary, and then this one is katong mo move together with the humerus or the lateral epicondyle of the humerus. Okay, so next, it's also very important that during shoulder extension testing, you have to stabilize the inferior angle of your scapula. So, where is the inferior angle? Here, katong marag pointing triangle. Yan ang hait diha. You have to stabilize this during shoulder extension because there might be a tendency na during testing, elevate og apil, and then we cannot rule out one motion only. So there might be errors during measuring the exact degrees, and then dili na din siya valid na result. Okay? So after that, we have after your shoulder extension, we have your shoulder abduction. Shoulder abduction, it moves away from the midline. So, shoulder abduction, like that. Shoulder adduction, from this position towards the midline. Okay, or towards your body. So, first we will discuss your shoulder abduction. Okay, so shoulder abduction, the testing position is supine position. You have to make sure that the patient is in a neutral position, including the shoulders and walay rotation, and then 0 degrees flexion and extension during the abduction na motion. For example, if yung ani naka-extend and then mo abduct ka, that is not the proper way. You have to make sure nga midline jud siya or naka-ani ka, flex ka, and then abduct. That is still not the correct way to measure your ROM. Dapat naka-neutral gihapon. Okay, so that is the testing position. The end feel of the shoulder abduction is firm because of the tension in the middle and inferior bands of your glenohumeral ligament, the capsules, and the muscles on the chest. Okay. So where do we position the goniometer? So the position of the goniometer, the fulcrum of the goniometer during shoulder flexion is close to the anterior aspect of the acromial process. So where is your acromial process? This one is the acromial process. Anterior, front. Okay, so this is where you put your goniometer. And then your do you call this? Stationary arm will just stay parallel to the imaginary line of the anterior aspect of your sternum. So for example, the sternum is your anatomical landmark. This is your fulcrum. Stationary arm will be parallel to the sternum or to the line. Okay? So this is your sternum. This is your stationary arm. Parallel sila. Okay? Your mobile arm or your moving arm is anterior midline of your humerus. So, diba, there is stationary arm. There gihapon si mobile arm. But inig move, syempre mo kuyog sad si mobile arm. So for example, shoulder abduct. This is the stationary arm. This is the mobile arm. Okay. Inig abduct. Bilin si stationary arm. And then, slowly move pod si mobile arm during shoulder abduction. Okay. So, this is the position. Like that. Shoulder abduction. Okay. Okay, next. So, question. How much is the normal values for the shoulder abduction? So, do we stop moving our shoulder when we say shoulder abduction up to this level? No. Your shoulder abduction goes beyond and up. Okay? So, on this side, up, move up. Okay. So, the normal value or the normal range of motion for shoulder abduction is 0 to 180 degrees. Again, it's 0 to 180 degrees. Okay. So next is your shoulder adduction. So, your shoulder adduction would refer to the motion which goes towards the midline. Or, because diba, you adduct, so you add, so more siya imong kwaon. So, that is adduction. Abduct is away. Okay. So, next is the adduction. Actually, it is not usually measured. Why? Because more mo siya returning point niya is 0 gihapon or the starting point of your shoulder abduction. So for example, your shoulder abduction is 0 to 180, then the adduction is 180 to 0. So if ever the patient is unable to complete full ROM, then if like siguro 90 degrees lang siya, then the adduction is 90 to 0 degrees. So it's not usually measured. Okay? Unless siguro dili jud siya ma-return to 0 if the starting position of the patient is like this. It's like this because siguro na ay pain or na ay bony structures na makalimit sa motion, then from here, up to here, and then up to here, up to this range, up to this movement, more ang iyang makaya na adduction. Okay. Now, let's move to your shoulder rotation. So, you have two types of shoulder rotation. You have your internal rotation and your external rotation. So, your internal rotation is referred as the medial internal rotation, and then the other one is your lateral external rotation. So let's go. We will discuss first your internal rotation. Okay, so next, the position of the patient during the medial or internal rotation. Patient must be in a supine position. However, unlike the other shoulder movements nga, like shoulder flexion, diba, sa shoulder extension, shoulder abduction, which are the arms are just on this side. This time, for the rotation movements, the shoulder must be in 90 degrees abduction. So, nakana siya. But, the forearm must be perpendicular to the surface. So, for example, nakalay down ko. This is the bed. Okay. My shoulders is at 90 degrees abduction, like this. So, if this is the bed, the forearm must be perpendicular. So, here, perpendicular siya, like bed. This is my forearm. Or it could be like this. Okay, so here, patient is in supine position. Shoulder must be 90 degrees abduction. And the forearm must be perpendicular to the testing surface. So, mura siyang naka-L lang or naka-ana inyong position, ka-L. And then, I'll just demonstrate na lang. This is your medial or internal rotation. Go back to the middle. Or neutral position. And then if you're going up, that is your external rotation. Okay. That's just for the demonstration. Okay. For example, let's go back na lang to the internal rotation. Internal rotation, you have to put a towel or something, but usually it's a towel, small towel. You put it here so that your acromion process and your humerus must be kanang level siya. Dili siya, for example, if there's no towel manggod, murag nakaana ang imong elbow. Okay? Murag siyang nakaslant. But if with towel, at least straight siya. So, there's no, it also helps stabilizing para ma-rule out lang sad ang rotation na movement. Okay, so that is the position of your patient during internal rotation and external rotation. Nakasupine, and then arms are just like this. Or, sorry, kasi this is external rotation already. This is internal rotation. So, dapat nakaana siya, like abduct, and then facing this, your fist is facing the ceiling if nakasupine na, nakaana. So, again, this is your internal rotation. Para makita lang, this is your external rotation. So, the normal end fill for internal rotation is firm because of the tension still of the joint capsule. And now let's discuss the position of your goniometer. So first, the fulcrum during internal rotation must be placed over the olecranon process. Again, your olecranon process is here. And the stationary arm is perpendicular or parallel to the floor. So this one, diba nakaana man to. So si goniometer na diri perpendicular to the floor. And then si mobile arm must be on the ulnar styloid. Okay, your ulnar styloid is this one. Ulnar, just follow this bone. Your ulnar styloid. So, si ulnar styloid ang imong mark for rotation movement. So, move siya. And then, you have to measure na the degrees. So, the position will look like this. Okay, this one. Remember, there's a towel. Look here, there's a towel para ba-level si acromion process ug si humerus. And then, during the motion, here, kita ninyo? Okay, ni-move na ni siya to internal rotation, going down. Okay, so that's it for your internal rotation. Now we go to external rotation. The same gihapon, testing position. You still have to place a towel under, and then you also have to stabilize the distal humerus. So, for example, when distal humerus here, so, di ba, naka-neutral, nakasupine, neutral. So, distal humerus, when you externally rotate, it could possibly move, move forward ba siya? So, it's better to put a towel para mas help siya og stabilize. Here, you could just press here para jud ang movement. Correct jud siya pagka measure. Okay. So, your shoulder external rotation, the same gihapon. Your fulcrum or your axis is over the olecranon process, and then your proximal arm or your stationary arm is parallel or perpendicular to the floor, and then lastly your mobile arm is at the ulnar styloid. Here, olecranon process to the ulnar styloid. So that is your reference. But the movement is opposite already. Again, internal, external. Okay?